Kate Granger is a geriatrician with Mid Yorkshire Hospitals NHS Trust. She graduated from Edinburgh University in 2005, and as part of her medical training, Kate came to Dumfries and Galloway Royal Infirmary, where she describes Dr. Ian Hay inspiring her to specialise in care of the elderly. In July 2011, while on holiday in California with her husband Chris, Kate was diagnosed with cancer. She was 29 years old. Since then, she's been admitted to hospital many times and has met hundreds of NHS staff. During a 2-week hospital stay in 2013, Kate noticed that lots of the staff failed to introduce themselves to her. She decided to do something about it using social media, and the hashtag Hello My Name Is campaign was born, and it's now reached its 2nd anniversary. In June 2015, Kate returned to Dumfries and Galloway as part of her week-long tour of 15 healthcare organisations to talk to an audience of healthcare professionals and students about the Hello My Name Is campaign and why it's so important. Dumfries and Galloway was the only Scottish venue in that tour.
We decided that we would do something positive, and this was a cultural thing, and it wasn't going to be made better by writing a complaint letter. We decided that we wanted to do something bigger. So we started tweeting about it, and the idea was to use my already significant social media influence to inspire, encourage and remind staff about the importance of introductions. And if you're going to do anything on social media, then you must have a catchy hashtag. So Chris set us up with the Hello My Name Is. We set off on this journey to talk about introductions, and I thought it would just be a few weeks of raising the profile of this within the healthcare community on Twitter, but little did I know what was going to happen next. I blogged about the experience and invited people to pledge their support. My brother designed us a website so that we could collate resources and pictures and information about the campaign. I started to be asked to write for various healthcare journals, health blogs, other health publications. And all of a sudden, we seemed to have a bit of a social movement on our hands. The logo was really popping up all over the NHS, and people kept tweeting me pictures of what was going on. People started using it on name badges, on lanyards, in conferences, and people were having their own little selfie campaigns with pledge cards, and there were balloons and cupcakes and all sorts of creative things. Then I, at the time, was working at Leeds Teaching Hospitals, and this experience came out of the Leeds Teaching Hospital. So I was very determined that they were going to become the flagship Hello My Name Is Trust. So I went to their chief executive, Julian, and I said, I'd really like to do something in the trust with the campaign. And he was immediately like, oh, right, I'm going to get Yvette, our medical director, and Suzanne, our chief nurse, and we're going to sit down and design what we're going to do. And it was really cool to have such a high-up exec buy-in to something. We also spoke at Expo last year, where we launched the inaugural Kate Granger Compassionate Care Awards, which were designed as part of my legacy and will continue long after my death. We just received the shortlist for this year's awards, so Chris and I have got a very difficult time trying to choose winners. The 2nd of February marked a really big day for the campaign. It was a big day for me personally. So I got up early, I went to BBC Leeds, and I got interviewed for the Today programme and then the 5 Live breakfast show. Then I got the bus up to the hospital, and I got attached to my Portacath, got accessed, and I got attached to my chemo. I then continued to do radio interviews on the phone, on my mobile, until Radio 2 got in touch and said, oh, would you come on Jeremy Vine this afternoon? We need to do it on a landline though. So I had to ask Sister Claire if I could borrow her office. She said it was the most bizarre request she'd ever had from a patient. So why was the media involved that day? Why were they so interested in what I was doing? Well, Together with the Listening into Action Network, we collaborated to have a big bang launch of the campaign across the country. They very kindly wrote to every single chief executive in the country of every NHS organisation, said, would you like to be involved? You can either do something big or something small, but we'd just like your pledge to say that you're going to be involved and push this forward in your own organisations. We got over 100 replies. And these are just a tiny proportion of the pictures we got back that day. My Twitter went wild. Hello, my name is trended all day. We got to number 1 at one point. How often do we have a positive NHS news story that is about us all collaborating together, us all sharing our experience and creativity and trying to improve things for patients and their experience? So it was really good that the media wanted to cover it. But why does it matter? And why am I spending my time doing this and dragging my husband around the country? Well, I think it's far more than common courtesy and good manners in healthcare. I think introducing yourself has such a poignancy about how you interact with another human being. One human being who's suffering and frightened, and another human being who wants to help. And in order for those two people to connect, then the first thing you need to do is share your names. So what does the future hold? My future is very uncertain. I probably only have months to live, although I've been defying the odds for 3 years now. But in spite of that, I remain ambitious. And I have ambitions for the campaign. I like to be able to walk into any NHS organisation, speak to any member of staff, and for them to be able to tell me how important Hello, my name is to them. There's 1.2 million of us, and so I'm not sure that I'm going to be able to reach every single person, but I'm going to try my hardest. I'm determined that people aren't going to feel sorry for me, and I'm going to become that tragic young doctor who died of cancer before her time, but rather somebody who made a positive change for the NHS. Somebody who pushed compassion, patient experience to the forefront of everybody's consciousness and really improved that for all our future patient generations. But no talk of mine would be complete without a tiny plug for my books. I've written 2 books about my experiences living with cancer. All the profits go to the Yorkshire Cancer Centre. Chris and I are up to £170,000 in our fundraising exploits, and we'd really like to make that 250,000 before I die. So if anyone does want to read, then please have a look at the website. Thank you for listening.